The former chair of the Governor's Physicians Advisory Group saying Adelup needs to do something to curb high COVID case counts and what many say is the Omicron surge on island. Dr. Hoa Nguyen resigned from the PAG last year because of what he said was political interference. The doctor telling KUAM News is the link, the hands-off approach to the pandemic response the administration is employing could have dire consequences.
If we're going to let the positive run the way they are right now, we're going to encounter a lot of problems in the long run. We cannot go on this rate and let it burn out by itself. I tell you, this is it's not a good idea.
Current PAG Chair Dr. Nathaniel Berg said in a KUAM interview he anticipated the surge would die down by February 1st, but Dr. Nguyen said the surge could easily stretch 6 to 8 weeks longer, especially since no meaningful restrictions are currently in place.
Put some restriction on the number of gathering should be the control factor to make sure that we don't have a big number of positive in the community. And I think if you do that, our people will listen.
Dr. Nguyen also said long COVID continues to be one of the risks associated with letting the virus run rampant. The condition has been seen in people who have contracted COVID-19.
They recover from the symptom, from the infection fine at the beginning, okay? But when they recover a few weeks or a few months later, they have shortness of breath that progressively getting worse, and that might be a lifelong symptom. We have two pulmonologists on island, okay? Dr. San Augustine at GMC and Dr. Julie Nagan. And the schedule for long COVID syndrome is about 3 to 4 months out. Wow. So we have to worry about this population that get infected.
In the meantime, pending the implementation of restrictions, Dr. Nguyen says the best we can do is avoid large gatherings and get back to basics. You know the drill. Wash your hands, wear your mask, and watch your distance. For Guam's News Network, Chris Barnett reports.